Do you know who first coined the term PCOS? Back in 1935, Dr. Irving Stein and Michael Leviathan described women suffering from irregular menstruation, infertility, obesity, and enlarged polycystic ovaries, and from there came the term PCOS, polycystic ovarian syndrome. But as science evolved, especially from the 1980s onward, modern medicine discovered that this was not just an ovarian disease. Insulin resistance, metabolic syndrome, androgen excess, inflammatory dysfunction, and systemic hormonal imbalance were deeply involved. And today, the term is slowly shifting towards PMOS, polyendocrine metabolic ovarian syndrome. What does it say in simple words? Modern medicine itself is now acknowledging that the problem is much bigger than just the ovary. But here is the important question. If the hypothalamic pituitary ovarian axis is involved, then can chronic stress, emotional trauma, anxiety, emotional dysregulation disturb this entire hormonal system? Modern science today increasingly says yes, but homeopathy recognizes the role of stress, emotional anxiety, emotional dysregulation, and disturbance of the HPO axis long before modern medicine began expanding its understanding beyond the ovaries. And this is why homeopathy has always focused on treating the patient at the root level, not merely suppressing the hormonal expression of the disease. But even today, despite terminology shifting from PCOS to PMOS, mainstream treatment largely revolves around hormonal pills, metformin, and metabolic management. These treatments regulate the symptoms temporarily. They may improve fertility in some cases, but the long-term hormonal and metabolic management is not completely free from side effects either. Homeopathy, on the other hand, does not merely treat the name PCOS or PMOS, it treats the patient as a whole. The mental state, the stress response, emotional conflicts, constitution, and vitality. Because disease is not just an ovarian problem or a laboratory report. Disease is a disturbance of the whole individual. And that is why, regardless of whether the name changes from PCOS to PMOS, the core principle of homeopathy remains the same. Treat the patient, not merely the disease name. Thank you.